I'm a community physician, so I don't practice in an academic setting, but in the academic setting, it was really nice. We had access to translator phones in which you could dial a number and have any language you could think of translated for you in a matter of a few minutes. In our private practice, we don't have that luxury, but we do have in-person services for most patients that are available and come to visits with each patient. We try to have an official translator because family, in terms of translation, doesn't always work out well because family can sometimes censor or change the message in ways that an appropriately trained medical translator wouldn't do. And so we have a policy in our practice to always have a medical translator available. And I think that has been a huge factor in making sure that the communication we have with the patients, the care we provide, is not compromised simply because of a language issue. What's really interesting is, now that the pandemic has come and is waning away, we are still, as an example here, communicating virtually and with video. I recently did a surgical case with a patient who was Russian speaking, and we had an iPad mounted to a stand, and this patient was not medically necessarily stable enough to undergo general anesthesia, so we did the surgery that he needed under local anesthesia care with an anesthesiologist in the room, providing a mild sedation. And we rolled that iPad into the operating room, right next to the patient where he could hear them. And the person translating for me in Russian was able to see me and hear me, as well as see and hear the patient underneath the drapes. And we were able to complete his surgery safely and successfully. And those extra steps that we take for patients that are non-English speaking makes a world of difference. I mean, I imagine myself going to a country in which I don't understand the language that the doctor and that every healthcare provider is speaking. And I can't imagine the fear that I would feel. I truly can't. And so we do everything in our power to make sure that they understand the goals of treatment, the expected outcomes, the risks, the benefits. We go through everything, but you have to take the time. And that can be really hard in a busy clinic. But if you do it that first time that you meet them, I think it really pays off down the line. You're not having second guessing. You're not having any repeated explanations that may have been cut short in the past. If you put the time up front for these patients, I think that you can really have an excellent quality of care that would be equivalent to one with a patient that speaks English natively.